Welcome to the Fall Prevention for Volunteers presentation. We're so glad you're here. Today, we are talking about helping keep patients safe from falls. Many of our patients have increased risk for falls due to their medical conditions or the medicines they are taking. They may have issues with balance or weakness. How do you know a patient is a fall risk? Patients who are at risk for falls will have a yellow wristband and will be wearing yellow socks. You can help if you hear an alarm go off or if a patient you are sitting with is trying to get up without assistance. You are the voice, eyes, and ears of the patient. Let's take a look at what you can do. Hospice of Cincinnati is a no-pass zone. No team member or volunteer should pass a patient's room where a call light or alarm is sounding without going in to see what they can do to assist. If the patient is in isolation, do not enter the room and notify someone who can. The patient is not in isolation and I'm in the room. What do I do now? Once you are in the patient's room, ask how you can assist them. If it is something you can do for the patient, fulfill the request. Acknowledge and thank the patient for letting us care for them. Let a team member know so they can turn off the call light. If you can't fulfill the request and there is no potential for harm to the patient, make sure the call light stays on and notify a team member. Let the patient know that a team member was notified and will be helping them. If there is a potential for harm to the patient, a bed alarm or other type of alarm is going off, or you've been sitting with a patient who is at risk for falls, stay with the patient until an appropriate caregiver responds. You should not reposition the patient or help them get up. You can push the call light for them so a team member knows to assist them. What are examples of some things you can do to help the patient? Reposition the call light, bedside table, and the trash can. Move the tissues and other personal belongings within reach. Assist with making phone calls. Change the TV channels. Open or close the blinds. Turn lights on or off. If you're trained to, you can assist with feeding. Remove a meal tray. Raise and lower the head of the bed. Offer support or respond to patients calling out. While it is uncommon, some of our patients can get to the bathroom themselves. The patient will be safer if the bed is in the lowest position. This is how you lower the bed. On the side of the bed rail, you will see a picture of a person lying flat. There is an arrow above the person and one below. Press the down arrow to move the bed to the lowest position. The picture of a person with their legs and back bent, with two sets of up and down arrows, moves the head and foot of the bed. What can an STNA or nurse do for the patient? They can physically assist the patient, respond to bed or chair alarms, or reposition the patient. What can a nurse do for the patient? Manage an IV or CAD pump. Offer symptom management medications. Explain clinical matters. What if the patient is in a long-term care facility? Do the same things you would do at one of the hospice inpatient care centers. You will be alerting the long-term care facility staff instead of a hospice team member. You may have to explain to the staff at the nursing home what a volunteer can do. What if the patient is at home? If available, notify the family if the patient needs assistance. If you are by yourself with the patient, you can help the patient with gathering personal belongings, assisting with the phone or TV, or other tasks where you are not moving or repositioning the patient. What are some tips for when a patient is distressed? Listening and providing a quiet, calm environment goes a long way in helping soothe our patients. Here are some tips. Listen to their issues and frustrations. You don't have to have a solution. Sometimes just listening helps. Speak in a calm manner and offer the patient reassurance. Soft music can decrease anxiety. Remove clutter around the patient. Try to reduce noise. Keep up the patient's routines. Ask them how they like something to be done. Let the patient do as much as possible for themselves. Gentle touch, hand massages, and reading to patients are calming activities. Distract them with snacks, music, activities, or looking at objects. What if the patient tries to elope or leave the facility? Guide the patient with your voice to return if you feel safe doing so. Don't get between the patient and the door. Notify a team member. What if I find a patient who has fallen? Acknowledge the patient if they are not in their room and get help. If they are in their room, use the call light and stay with the patient until help arrives. Thank you. Hospice of Cincinnati volunteers are the heart of hospice. Thank you for all you do.